The CDC has identified three new strains of COVID-19 virus, one from the United Kingdom, one from South Africa, and one from Brazil. Those are currently being studied by the CDC and the NIH to determine if they are more contagious. Interestingly enough, there are 7 new variants that have been identified in the United States. Those too are being studied by those organizations to see if they are actually new variants or just variations of the disease. The data is still being determined as to whether or not those 7 strains are more contagious or if they're actually true variants. So the NIH and the CDC and governmental agencies are looking at those new strains and collecting data to determine what they really mean. In order to protect ourselves against the new variants, we don't need to do anything differently than what we were doing before. That's the 3 Ws. Wash your hands, wear a mask, and watch your distance. The vaccination is also useful, but it's just one tool in our fight against COVID-19. The data currently indicates that the vaccination does confer protection against the new variants. As the CDC, the NIH, and the pharmaceutical companies continue to gather information, we will understand in the future whether or not the vaccinations actually confer full protection. There's quite a bit of data that supports wearing 2 masks rather than one, especially if you don't have a medical grade mask. I guess an easy way to think about it would be that one mask protects you from me, and the other mask protects me from you. Herd immunity is when enough people in the community have immunity that it's unlikely to spread the virus. In other words, it's when enough people in the population have achieved immunity that it's unlikely to spread it to those who are not protected. If about 70% of the population achieves vaccination or achieves immunity through vaccination, then it's unlikely to spread the virus to those who are not protected. Our new normal will really depend on a couple of things: what the CDC recommends and what our government officials say we can and cannot do. What is definitely known is that we're still in the midst of a pandemic, and even vaccination and prior infection with COVID-19 does not confer 100% immunity. For me personally, I wanted to protect myself, my friends, my family, and my patients. That's why I was vaccinated. So I understand that many people might be fearful of getting the vaccine. One of the best things to counteract fear is education. So make sure you have adequate, appropriate, factual information about the vaccine.